This session is about some of the non-required components of the discharge routine. So doctors don't have to do these. You may find yourself wanting to if you like the way the electronic system starts piecing together. And this is actually one of the places where it starts making sense. Let's look down here in this section, stuff physicians may do. So in the forms section here, there's several different things. You'll see things like hospital bed order, nebulizer face-to-face. You think, well, this isn't for doctors. Well, you're right, it's not. This is intended for the case managers. And this is a way, let's go ahead and here, and we can see the case manager has already created this hospital bed order and filled in all of these different documentation elements that are required by CMS. So that is something then that the case manager would print out. It shows up as a piece of formal documentation. The physician can sign off on that. There's a paper process for that now, and this is much improved from the case manager standpoint and doesn't affect doctors' workflow. You do see some of these things that you might find yourself doing, like a work excuse, for instance. So you can go into work excuse, and it's pretty intuitive stuff. I won't go into that. Excuse from work here, return to work here, can fill in some supporting details. That's very simple. The discharge summary is not something that's simple. This takes you into the PDoc, the physician documentation module in Meditech that requires some training. Some of the components can be pre-populated. A lot of it is free text, which kind of brings up the need for the use of Dragon or excellent typing skills. There are a couple of benefits that are around the corner here. One is in the discharge medications. This little field here, if you have already spent the time reconciling the medications for discharge and you click the Update Prescriptions button, then it will automatically populate your discharge summary with medications. Same with appointments, and we'll come back to this in a second, but if staff has already scheduled appointments as you've requested, then it'll fill those things in. So that's pretty handy. But again, it's really intended to be a stage 2 of the discharge summary rollout. Now let's come down here to the stuff others can do, but physicians can edit. This top one here, anticipated discharge date. This section is really intended for case management. So you can see that the case manager has kind of been involved in the case here and anticipates that discharge will occur this date. If you want to go in there and change this, you can do that, but that's not what it's intended for. This little post-it note here is a section from the case manager's most recent progress note and will include kind of a summary of things that case management is working on. So you don't have to go over there into care activity and interdisciplinary discharge planning, and is a shortcut, a snapshot as to what's going on with case management discharge planning. The follow-up and appointments section here is the area where when appointments have been made based on orders you have requested, they will show up in this section. So up in the discharge, in the planning orders or in the discharge order itself, if you said please schedule a follow-up, this is where you can see the staff has actually gone into the system and scheduled this follow-up. And down here, this last row is patient education materials. Nursing for a long time has been handing out standardized patient educational materials. Sometimes it's called instructions, but it's really a generic, high-level third-party vendor overview. If you want to go in here and add additional discharge instructions, this takes you into the same. I just did it. Patient education materials. You can do that to make sure the patient gets it. That's fine. You can also preview it from here. I see in the test system. I don't have that set up properly. In the real world, I know you can preview that. So those are some of the kind of overview benefits of having an integrated multidisciplinary discharge routine.